Hey, you mouth-breathing goofs. Stop doing that. Your mouth isn't intended for breathing. It's intended for exhaling. Maybe, potentially, but when you stop sucking up the upholstery at night, you're going to be breathing and you're going to be sleeping better. How about that? Are you a mouth breather? I know a few. Most of them, have little propellers on top of their hats, or they wear helmets all the time, so they're easy to spot. And they shop exclusively at Walmart. Here are the surprising benefits of making the switch to breathing through your nose. Yeah, you don't look stupid. You aren't mocked in public. And, well, I'm sure that there's probably something a little bit more substantive than just my childish remarks. Recently, we've all become acutely aware of how important respiratory health is. Yes, of course, and you needed to be reminded of that. It's like, I can't breathe very well. How is that for you? Well, if I could breathe better, things would be better. Oh, wow, tell me more about your experience. With that in mind, the growing trend and conversation about the health benefits of nasal breathing could not have come at a better time. Yeah, exactly. Blow your nose, stupid. Stop slurping? I don't know. Just pick a word. Make up a new word. If that's what it sounds like, good. It works for you. Run an onomatopoeia on whatever your belabored inhales sound like. And while breathing through your nose appears to be explicitly beneficial, the alternative, being a chronic mouth breather, a sign of high intelligence, it's not. It's exactly the opposite. Could actually be harmful to your health. Wow, tell me more. According to a 2015 clinical review published in the peer-review Irish journal, Nursing in General Practice. Yes, we want to know how we can drink more alcohol. And boy, some of us be breathing through our mouths, and we want to know if there's a way where we can drink and breathe at the same time. And Lord be know, we have the nose right above our alcohol dispensary, so we figured out I might as well imply that. Breathing through the nose creates an increase in the airway resistance by up to 50%. Cool. Since airflow resistance during inhalation helps maintain the elasticity and volume of the lungs. The net result is a 10 to 20% increase in oxygen uptake in the body. So by breathing through your nose, you work your lungs. Interesting. Well, exercise your lungs, I guess, if we want to get technical about it. Breathing through your nose is also likely to improve oxygenation in the body because once inside the nasal passageway, the air is exposed to a network of arteries, veins, capillaries, and lymphatic vessels. Interesting. Breathing through the nose also naturally slows the respiratory rate, of course, because it's not quite as big as an access point in order to get to your lungs as your throat. It's just more efficient. You have a nose for a reason, so use it. Okay? This is exactly the sort of slow, deep breathing that can stimulate the vagus nerve, which plays a central role in facilitating the parasympathetic nervous system mediated relaxation response, as noted by a 2018 paper in Frontiers in Human Neuroscience. Another interesting benefit of nose breathing is in the way that it promotes the production of nitric oxide. All right then, a compound produced in almost every cell in your body, and a potent bronchodilator and vasodilator. Therefore, explains the author of the 2015 clinical review, it helps lower blood pressure because it's dilating, making larger the different passageways throughout the body. I tried to say pathways and passage in the exact same word. It's not a word. It's an amalgamation. It's an abomination of a word, and significantly increases the lungs' oxygen absorbing capacity. It is also known to be an antifungal, antiviral, and antibacterial. Yeah, and it got banned because that used to be one of the OG supplements I used to take, and like a good pre-workout with nitric oxide inside of it. Ooh, there used to be some good ones, and then stupid Canada banned it, and I don't like that. That's dumb. Nothing wrong with it. Your body, it's a natural compound, mate. Anyways, I could go on for days about that one. That makes me so sad. Nasal breathing has also been shown to improve air moisture. Okay, don't mind me. Provide a natural filtration system by trapping airborne debris in your nose hair and mucus. Mucus? That's not a word. Potentially prevent or alleviate common colds, allergies, and hay fever. I guess stupid people get sick more. That's interesting. Support appropriate action of the diaphragm, of course, because your body's designed to breathe through your nose. Holy. Promotes the correct alignment of the tongue against the upper palate, which supports the formation of dental arches and straight teeth. Because you'll also notice there's another diagram that I've seen out there. Okay, your common mouth breather with a recessed jaw. Okay, just kind of lurching forward. with their belabored breathing, as opposed to your Chad nose breathers who have better posture overall as well, and improved air moisture as well. So everything's a lot more moist. As for the alternative, predominantly breathing through the mouth, done by about 30 to 50% of the population. That's a big bar of people, okay, suggested to be linked to an increased risk of gum disease. Yeah, because your mouth is drier and therefore more bacteria will be brought in through your nose. That makes sense. Bad breath, see the previous reasoning. Dental decay, same gimmick. Snoring, sleep apnea, jaw joint dysfunction. Inefficient upper chest breathing. Yeah, of course, instead of just having a proper deep breath, you're breathing all the way up in the top of your chest, okay, which is just terrible practice to begin with. Teeth malocclusion. Okay, so that's your recessed jaw so that your teeth don't properly clamp down on whatever you're eating at the time, okay, but you're constantly trying to battle an inhalation along with eating. That must be tough. Speech and swallowing problems and enlarged tonsils and adenoids. Yes, because they're constantly filtering air at the same time. Breathe through your nose. Breathe through your nose. Break the mouth breathing habit with these 3 tips. Oh, we got tips. Set reminders such as a periodic alarm on your phone to stop breathing through your mouth. Stupid, you're drooling all over your phone. Set aside a few minutes per day to practice breathing exercises. Yes, of course. I always recommend box breathing. Not that box, you creep, okay? But setting a certain amount of time, 1, 2, 3 count for your inhalations, your holds, and then your exhalations for that same amount of time. You can fuss around with whatever works for you appropriately, but whatever you're thinking about it, your inhalations come in through your nose, your exhalations go out through your mouth. Proper breathing techniques, okay? And just, yeah, set aside some time if you get stressed out when you're driving home after work or something like that, and take the opportunity at a red light or at a pause or whatever to just do a couple of simple breathing exercises. Consider taping your mouth shut at night when you sleep. All right, you can buy tape made specifically for this purpose. You know what you should do? Okay, you should get some saran wrap, just wrap it all the way around your face, and then just poke holes for your nose. Everything will be fine. Don't worry about it, okay? Be aware the technique is not appropriate for some people. I would imagine taping your mouth shut probably pretty drastic for some people, and especially those with nice facial hair, including people who struggle to breathe through their nose. Oh yes, have severely chapped lips, are obese, consume alcohol or sedatives before bed. Oh, so fun people, huh? Have heart or blood pressure problems, or are currently affected by cold, allergy, or sinus problems. Yes, of course, people who are ill probably shouldn't be taping their mouth shut, and I never recommend that anyways. That's very interesting. You should probably work on the rest of that stuff, okay? Because if you're fat, you need all the help you can get, and especially if you're lying down on your back, okay, you're gonna have belabored breathing to begin with. So by cutting off one of your available orifices in order to get adequate oxygen into your system, probably not the best form of practice, but hey man, to each their own. Finally, if you have chronic congestion making it difficult to breathe, you should look into changing your diet to reduce mucus buildup. Things to consider and eliminate are dairy product, especially conventional brands. Yes, of course, anything with full or total lactose in it. That's the main contributor to any inflammation that's in there, causing an additional milk or mucus buildup. Okay, simple sugars and flour products. Yes, of course, gluten and sugars basically poison. Talk to an integrative healthcare provider or an ear, nose, and throat doctor. You know, an actual professional instead of somebody saying, "Well, do you hang any crystals above your bed?" Yuck. So, with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.